Hello everyone, my name is Alex Ramirez, and for this Module 3 discussion assignment, I'm going to be talking about the surgical procedure of a total knee replacement. A post-op total knee replacement doesn't have many restrictions. Us PTs, we want to get the patient moving as much as possible, obviously within their pain tolerance. They are able to try to get as much range of motion as they can. You don't want to push it too much just because it's going to be very painful, but you want them immediately doing ankle pumps, glute squeezes, quad sets if they can, just to kind of get the blood flowing and ultimately prevent DVT if they can. The patient, they're going to be very stiff, they're going to be in a lot of pain, they'll probably have some bruising and a lot of swelling. So there isn't much you can do right away, but what we do as PTs, first, second day post-op, we'll help them with their transfers, sit up, getting out of bed, getting to the bathroom. We'll also help them walking with their walker. So these are all little things that are within their protocol. They're allowed to do this within the first couple of days because this is what's going to allow them to get home and have functional activity. There is one transfer that I'd like to show you that if done improperly, it could break a lot of restrictions and it could cause a lot of pain and put that knee in a vulnerable position. So behind me, I have a chair. Imagine this is a car seat, and I'm going to walk you through the process of how a patient will probably do this, thinking that they're okay, to how they should be doing it. So think of a normal, healthy person with no knee surgery. This is how we would get in the car. So I'm going to open up the door. I'm going to drop my head in and just sit right in. Okay. There's a couple things wrong with that. A total knee post-op patient won't be able to do that for two reasons. Their knees aren't going to be able to bend at 90 degrees of flexion. So sitting like that in a car is going to be very uncomfortable for them. The second reason is getting in the car, they're going to have a walker. And with that walker, it needs to be underneath them for full support. So if they just stick one leg in, they're already off balance and they're putting all that weight through that one leg. That could cause the knee to be in a vulnerable position and ruin the whole surgery. So what you do as a patient with a walker is you have to sit in the car first. So what we're going to do is we're going to have that walker. We're going to back up into it so our back's to the seat. We're going to face away from the car, and we are going to gently sit down in the seat first with our legs hanging out the door. From here, what we're going to do is take both legs. We're going to swing it both gently right into the car. You'll probably pull the seat back a little so they have room so their knees aren't bent so much. The door is clear. Make sure their assistant or their spouse puts the walker in the car, and he's good to go. The way you get out of the car, it's very similar, just in opposite direction. You swing both legs out. Okay. You have the walker right on top of you, legs right in between the walker. You're going to scoot towards the edge of the seat if you can, and then you're going to use that walker to push yourself up, and then you're up and good to go. You just don't want to just step out. That's when your knee kind of will buckle on you because you don't have that strength yet in the quads, and you're going to be in a lot of pain. So your first instinct is going to want to be to drop, and then falling is the biggest worry. With this post-op protocol, you want to prevent the individual from falling as much as possible, and by doing that, we kind of walk them through their transfers as PTs. We walk them through their gait, make sure they're walking right, and just helping them with little steps like that until they're able to build up enough strength to fully function without any help. And that's about it. Look forward to hearing what you guys have to comment. Thanks.